Welcome to our PRBI live session today. I'm your host Tarunjit Ratan, and today we host our PRBI member David Ball on our live session. David is the president of Ball Consulting Group LLC from Boston and will speak to us about crisis management in healthcare PR today. A little bit about him before we get started. He's a seasoned strategic communication expert with over 3 decades of experience in the field. He specializes in crisis management and healthcare. You can only imagine how busy he must have been in the last 6 months. As expected, in the last several months, he's helped many brands in the healthcare space quickly plan and implement a crisis management plan, controlling the damage to their reputation and building from there. His expertise includes communication solutions for providers of care that include hospitals, health centers, long term care facilities, physician networks, pharmacies, medical equipment suppliers, managed care organization, health plans, technology companies, and regulators. He's frequently engaged as a crisis communications expert across all these sectors to handle highly sensitive, complex, and controversial matters, and as an advisor to CEOs around the world on PR, marketing, and public policy related positioning. We are very lucky to have him here with us today. So join us as he speaks to us about how to handle a crisis in the healthcare space and effectively navigate the many twists and turns along the way. So let's add him on and get started. Hi, David. How are you doing?
Well, Taranjeet, how are you? Thank you for having me.
Absolutely, it's an absolute pleasure to have you here with us. So, before we get started, tell us a little bit more about your journey. You've been in the industry for 3 decades now.
Thank you. Yes, it's not a conventional path to communications. I actually worked in government for a long time. I studied government, political science, and public administration. But I had the opportunity while I was working in government to do communications work and to deal with the media and try to market the organization that I worked for, which was state Medicaid agency. And once I started doing that, I kind of felt like I like this. I feel comfortable with it. It's challenging. It's interesting. It's dynamic. So I then took that practice and went outside to other sectors outside of government. I worked in the hospital industry, long-term care industry, and then started this firm about 16 years ago.
Wow. So, why did you decide to start your own firm instead of, working with other organizations?
Well, I always say that it was, I had just passed a milestone birthday, and I was the VP for communications at the Hospital Association here in Massachusetts. And I went into my associate's office one day and said, I had a big birthday over the weekend and I want to do something dramatically different. So I'm going to hang a shingle and start my own consulting business. And he looked up at me and he said, well, couldn't you just buy a sports car? That would be a more traditional, midlife change. But not, I always liked what I did. And I thought, gee, if I could do it kind of on my own terms, helping a variety of different clients, trying to grow a business that is responsive to the needs, of different kinds of organizations, that would be a great challenge. So that's what I did. And it was, it's scary to do that, to leave a job. I had young children at the time, and it wasn't an easy. It was a leap of faith for sure. But I guess it's kind of like going into the ocean. When you first go into the ocean, it's very cold. After a few minutes, you don't recognize that, and so that anxiety kind of over time goes away, and you just find
Right.
your element.
Right. What was your family's reaction like when you told them that, I'm quitting my job and I'm going to start my own business?
I think, there was support. I think that people had confidence in me, but I think, it was a variety. As I told family and friends, some people thought that's great, control your own destiny. Other people said, "You sure you want to do that?" There's a lot of people fail at that. So I think it depended largely on the person I was telling it, what their
Right.
opinion was.
Right. So how do you go about selecting clients, for your company? What kind of clients do you prefer working with? What is your client selection process?
Well, we have a couple of different disciplines. So we do proactive PR and communications. And for those clients, we tend to focus in the healthcare and human services space, nonprofit,
Right.
higher education. We kind of do everything, but those are our areas of focus. And then on the crisis side, we work with all kinds of organizations. We do, again, a lot of healthcare and nonprofits, any kind of organization that's having a crisis. We'll
Right.
generally try to help. So on the proactive side, we want to make sure we feel like we have issues that we can work with, that we have a story to tell, that we have something that's capable of generating news, or
Right.
a thought leader that can have a position, leadership position, that people are going to listen to. And so those things are important. Because there are times that we tell clients, it's maybe isn't the right time for PR, your product isn't mature enough, or not enough. We don't think it's going to be interesting. There are times that we have those decisions to make. In the crisis mode, it's more that clients choose us than we choose them, because people tend to come to us. As much as we try to talk about the need to do crisis planning and to be prepared and be ready, a lot of organizations never think about it until the news van is parked in the parking lot. So in those cases, the clients kind of choose us.
So, is crisis communication one of your key fortes?
Um, I'm sorry, client communications.
Is one of your key strengths?
Yes. I think that, in the sense that we, help our clients to try to really figure out kind of what their messaging is, what they're trying to communicate. But I think also from the perspective of being in an agency, you have to have open lines of communication with your clients, and you have to know exactly what's going on in their organization. You can't feel like you're 100 miles away. You have to feel like you're in that decision-making process.
Right. So I'm sure in the past 6 months, your services must have been really, really required and must have been really very much in demand. Can you share a few examples of how you helped your clients battle, with COVID-related cases with when the pandemic struck?
Yeah, it's really been really a journey since it feels like,
Yeah.
in some respects, it feels like March 17th, when everything kind of closed down around here for the pandemic, was yesterday. And on the other hand, it feels like I've lived 10 years in that period of time, because we work with a lot of nursing homes. And during the pandemic, we were representing about 20 nursing homes. And the things really went downhill pretty quickly for a lot of those facilities, because of the fact that they were dealing with a virus that was invisible,
Right.
that no one could control. Families couldn't visit their loved ones, and that created tremendous angst and stress. And employees were worried about getting the virus. And for employees who might have small children at home, they had to choose between coming into work,
Right.
getting exposed to the virus, or not doing that so they can tend to their families. And that's a decision that no one wants to be in. The thing that really struck me is that the people who work in these buildings, are really heroes. They put the needs of the residents and the patients above everything else. And they were incredibly committed. And I think, but as bad as it was here for people living in senior care facilities, had that level of commitment not been there, it would have been 10 times worse. They worked really hard. And so we had one nurse, just to give you an example, we had one nursing home client, and they had a building that was very large, and they were planning to convert the building so that they could treat people coming out of the hospital with COVID and move patients out of the building and just become a dedicated COVID facility.
Just one thing. Before, for the benefit of our viewers who are not from the US, could you define a nursing home for them?
Thank you. I appreciate that. And I should have thought about that. Nursing homes provide subacute care. So hospitals provide acute care. If you have an acute medical condition, you go to a hospital. If you need to rehabilitate, after having surgery, you might go to a nursing home for rehabilitation. Or if you're tend to be very elderly and maybe you have dementia or some other really serious conditions, you go to a nursing home to live. And it's a good point, Taranjeet, because not all cultures, not all countries have nursing homes. In many parts of the world, when you have an extended family member who needs that kind of care, you care for them at home. And it's something that I think is distinctly, American, that these facilities, that there's a huge industry of facilities that do this care. So we had these clients that had these situations where people, they thought no one in their building had COVID-19. Everyone was negative. And then they would test, and they would see a huge number of people had the virus, but they were either pre-symptomatic or asymptomatic. And you just didn't know until you did the testing. There were just so many unknowns about the virus. That it really made it very, very hard to manage. We have a lot of human service agencies that provide care for people with developmental disabilities. So people who are slow to develop mentally, cognitively. Same issue. They couldn't have family visits anymore. They couldn't go to their day programs where they get daily services. And again, you saw this, really the people who work in these programs who don't get paid a lot because of the nature of how those services are funded. Those people don't make a lot of money. And they stepped up in a truly heroic and amazing way to make sure people were taken care of. So I feel like it was stressful for us as a PR firm trying to communicate and deal with the news media, but what those people went through, I can't even relate to, because it was just such an incredible thing. So we're really proud of our clients and how they handled the situation.
I'm sure I'm getting goosebumps here. So
I do too.
It's so heartening to see somebody, especially the nursing staff out there, the doctors out there, to be able to put the needs of the many against, in front of their own needs. So, when you got into this particular case, I'm sure it must have been a chaotic mess. And, while we love media, they can also be mediums to add to the chaos, rather, right? So when you stepped into this particular case, how did you help them, turn the tide? What was your key piece of advice to them?
Yeah, the number one piece of advice that we had was you have to really communicate with your key stakeholders. So families of the people that you serve are very, very important. You have to keep open lines of communication with them. Be sure to provide regular updates, so that people know what you're dealing with, updates on the number of cases, and be transparent with the data. It all has to be reported anyway to the government. Government tracks all that data. So it's going to be public, like it or not. So you might as well be transparent and open and direct about it. Those are really, I think, the keys. And not to, generally with all of our crisis work, the thing that we always try to emphasize is not to have your head, in the sand, not to pretend that you're not in the middle of a crisis, but rather to be proactive, to deal with it head on. And the organizations that do that, tend to be just fine after a crisis. It's the ones that I think that, that it's not going to be a problem or there's not going to be an issue that really get surprised. So, I think the message from us to our clients was be transparent, be proactive, communicate, over communicate. And there's really nothing revolutionary about that, as you know, as a practitioner. It's kind of PR 101, but sometimes they need someone to come in and provide that guidance. That's what we tried to do.
So in this particular scene, what was your most difficult moment?
It was, I had to separate the work from, myself, as much as possible, and we'd hear these, we had some clients that were dealing with many deaths. And I would, they would go from, one day having no one with COVID to the next day having, 20 people with COVID, go from having no deaths to having 10 deaths, because of the nature of this virus, which is just horrible. And our staff, we closed our office, and everyone was working remotely, and that was challenging. So, where I would have colleagues and comrades to, try to decompress and talk about it, there really was no one. Obviously people are accessible and you can talk by phone and Zoom, but it's just not the same. So I found myself, in March and April, early May, just trying to have to fight off, depression about how serious this was and the impact it was having on people. That to me was the hardest thing, was trying to just, kind of power through it and know I had a job to do and try to detach myself as much as possible from it.
I think that the objectivity, with which you would have to deal with this entire situation must have been crucial for you to succeed. They say that, especially when somebody gets into in the mental wellness space, the doctor or the psychiatrist or the psychologist has to have strong mental resilience.
Yeah.
It's difficult for them to treat patients.
That's right. Yeah.
So, did your company also go through a lot of changes during this time? Has your agency changed its way of working, or did the existing model, adapt itself to the current situation?
It was a very different model for us, operating virtually. We had, for example, a new member of our team join us like a week before we shut down, and so all that normal time you have to onboard someone and get them, that was gone, and we had to do that virtually, which is doable. Clearly, I mean, everyone in the world is doing this stuff, but it was different. Obviously, always the issues of capacity. You have to make sure you can adequately serve your clients. You don't want to make sure, if you're committing to them, that you can give them your full attention. In those early days, people kept coming, to us saying, "I need help with this. I need, we need some guidance and assistance, support." And you never want to say no to people who are in the middle of that as well. So, we tried to serve everyone that had a need. We also tried to share kind of what we were seeing early on. We did webinars with different trade associations and professional groups to say, here's really what you need to do as you begin to deal with this. And the interest and engagement in that really surprised me. We did one with a senior care group of providers, of elder providers, and we had like 40 or 50 providers and, like a couple of days notice. So people were just really clamoring for help and information. This is, everyone keeps saying COVID-19 is unprecedented, and it is. I mean, nothing in my lifetime has ever been anything like this. And I think that's the case for most everyone. We're just living unless someone lived through the, 1918 Spanish flu. I mean, there's just been nothing ever like this.
It's true. Yeah, it's a new situation for everyone, and I'm hoping that changes the way we live and make it, turn towards more mindful living. But well, let's see how this pans out. But when there is valid advice or valid counsel being given, whether it's through a webinar or through an article for that matter, I've always seen that when the content is good, people will listen. And I'm sure people would have flocked to the webinars that you did earlier. So has the ask from clients changed in the last 6 months? And has your approach towards them in how you approach PR for them changed?
Well, I think people are, the focus is different in that clients aren't looking to necessarily make long-term commitments because they just don't know what the future is going to look like. I mean, we could, as you know, we could have a vaccine in January and potentially, or we could have not have a vaccine for another year. We could be in exactly the same place, God forbid, but we could be in exactly the same place next year that we are today at this time. So all of that uncertainty, I think, is really weighing on businesses and organizations. And, even things like a lot of our clients provide services that are contracted with the government. Government has, in the US, and I think it's the case probably globally, has put huge resources out there to try to mitigate the impact of this. But there's less revenue. They're collecting less tax. And so state governments, in particular, are going, and in our state government here, we're looking at a multi-billion-dollar deficit. And that's going to have to impact everyone. So if you're a nonprofit and your revenue comes from the state, and the state is looking at a multi-billion-dollar deficit, well, then you can't really embark on a communications program. It's going to be long-term. So I think that what people are looking for is very different. We've probably, in terms of the volume of our work, we've generally been about 2/3, proactive kind of ongoing communications work, and 1/3 crisis work. And that's really, over the last 6 months, completely flipped, probably to 2/3 to 3/4 crisis work. So the nature of what we're doing is different.
But it must have been very difficult to turn away clients, especially NGOs, nonprofits who probably wouldn't have had any money, but would have wanted, desperate help from you in crisis communication.
Yeah, we serviced everyone that had a need. There was no time during the height of the pandemic where we said, we're just overloaded. We all worked a lot harder, 7 days a week in some cases, to try to help organizations. The biggest challenge when you do this work is there's no predictability. It's not like an accountant that knows, I'm going to have tax filings due at this time of the year and it's going to be incredibly busy, but then I'm not going to have to work hard for the next 3 months. You could have a day when it's very quiet and then all of a sudden have 2 or 3 different clients, particularly with COVID, because of the nature of it, where they'd have immediate issues. And so there's really been no predictability, in how much activity, but we just kind of, it's like anything else, you break it down, right? You just you have 2 things going on. You have multiple people trying to get facts. You put statements together, and again, the more planning you can do. We have some clients that we've actually done crisis plans for, and so we have those crisis plans, template statements that deal with most every situation. So if you can take something off the digital shelf and put in a few key facts and know that it's good, well, that's going to take a lot less time than trying to figure out something from the ground up. So the more that people, and I think it's always difficult trying to be an evangelist on crisis planning because people figure we're just trying to sell services, but the proof is in the pudding that the more planning you do, I think the easier it will be to manage when things go wrong.
True. So how's your team dealing with it?
We try to do a lot of engagement to make sure that people are okay. One thing that came out of this was because we were all working virtually, we did a daily Zoom call at 9 a.m. just to check in on everything. And
Right.
sometimes the calls were brief, sometimes they were longer. But in all the years we've been running this business, we've never had like a daily session. We do once a week, we would get together and kind of plan things out every Monday, but we never had like a daily, like, huddle. I don't know why. I mean, we would talk when things needed to get done, we would communicate too, but we didn't have like a daily huddle where we just all got together. And that's been one of the good things to come out of this, is that now we're all back in the office, but we've institutionalized that. So every morning we have a huddle. We still do it by Zoom for social distancing purposes, but it works well.
So everybody's back in office?
I'm sorry, I didn't hear you.
Everybody's back in office?
Everybody's back, yes. We only in the last couple of weeks. I started back in the office over the summer, and then after our fall holiday, Labor Day in September, we brought folks back. We're a boutique, yes, evidenced by the fact that we're in PR Boutiques International. So it's not like a huge operation, but yes, our folks are back in the office.
I mean, it must be so good to finally, be and meet in person, your entire team. I mean, we just started off for a couple of days in a week, and it's just very heartening to meet people and see them face to face and be able to talk to them. I think the last 6 months have been very crucial in helping us not take that simple act of meeting each other, take that for granted.
It's really very important, to see people face to face, or at least mask to mask. Where we have all in our office, we're all wearing masks. We still don't have some of the things we enjoyed doing before the pandemic, like having, bringing lunch, or or we haven't done those, social gatherings, at the end of the day or what have you. But yes, it's much better to be in person with people than it is, over Zoom. Okay. And the same with the thing I really miss, in addition to being with staff, has been clients. I would spend a good chunk of every week on the road, having lunch with clients, or just going to their offices and meeting with them. And I really miss that. So I'm looking forward to a time when that will happen again.
True. Aren't we all?
Yeah.
Yeah, it's let's move a little bit toward the media side, right? I think globally it has impacted the media industry a lot as well. And world over, there have been pay cuts, there have been job cuts, and it has also changed, PR's association or relationship with the media industry. How has it been in your part of the world, and how has your agency adapted to, keep up with the changes?
Well, I think the biggest change, is just the news cycle. We have an incredibly crowded news cycle. For months, all the media would cover was COVID, which made it frustrating because there were other things happening. And now in the U.S., there's like 4 or 5 main drivers of news coverage. There's COVID-19. There's the fight for racial equity, and that's been a major story. The passing of Supreme Court Justice Ruth Bader Ginsburg, and when that seat will get filled right now is a huge driver of news, and the election. So, we're really trying to plan out if something doesn't fall into one of those buckets. We're trying to be realistic with clients, saying it's going to be hard to get it covered, and we have to time it really, really carefully. For some clients, that will mean putting news out after the election, but before the winter holidays. So it's made it much harder. That's the nature of the news cycle. There are always things that drive the news, but it's kind of like, the thing that I can remember is 9/11. After 9/11, you'd be really tone deaf to pitch something that wasn't related to that for a long time. I think the same is true now, except instead of it being like a 1 or 2 month, media blackout, so to speak, it's a it's just been ongoing since the spring. So it does change the ability for things to get covered. So
So how are you planning new campaigns? Are you looking at launching new campaigns? Because I believe Christmas and New Year are also very important, right? Important occasions for in your part of the world.
Yes, they're certainly important, and they're a big driver of PR activity. Less so in our case because we don't do a lot of consumer PR. We don't do product PR generally. The products that we, are healthcare, products or higher educate, but they're not products in terms of consumer, items. There are certain stories around the holidays that are better to pitch. Obviously, stories about humans challenges and heartwarming stories. And to give you an example, last year we had a client that runs an adoption agency, and they had families that were finalizing adoptions, and that happened right after Thanksgiving in that kind of holiday news cycle. So that was a story that got a huge amount of coverage. They had some interesting families, and it got a huge amount of coverage. It wouldn't have gotten the same level of coverage at another time of the year. It would have gotten some coverage, but it wouldn't have gotten, kind of every, media outlet in our region covering the story. So you do try to time things to be opportunistic. The turn of seasons, is something. We have some clients that are in the wellness space. So when summer rolls around, when fall rolls around, there are things you can write about that are specific to those seasons. So we're always looking at the calendar to try to be opportunistic.
About the agencies, I'm sure it must have been a very sweet and heartening story.
Very much so. Yeah. I'm always touched by the work. You really see a lot of amazing things when you do this work, and you learn about, the people that you work with and their situations, their triumphs. And so it always touches me personally.
So, you have been in PRBI for some time now. Tell us how this membership has affected your company's development over the years, and what are the key benefits from this membership that you feel for you?
I honestly believe joining PRBI was really one of the smartest things we've done as an organization. It's given us the ability to really learn best practices, in the in the trade and in the PR profession. It's given me the opportunity. It's hard running a business, and learning as you go, and having 30 or 40 other people who are in the exact same position that run small firms, and deal with all the same set of issues. That's a really really good thing. And it particularly was helpful at the beginning of at the pandemic. We were thankfully busy because of the nature of our work, but there were some firms that were seeing huge fallout in business because of this. And again, those more consumer-oriented, firms that where campaigns were just being suspended. So to be able to get together and talk with one another and share advice and insights was a very, very positive thing. I've just always found it I've made a lot of friends. We've only been in PRBI for, I think 3 years, but it's been just a wonderful experience. And we were looking for an association to join because, we are a small firm based in one market. And, as you know, in PR, you can apply your trade in any media market. I mean, you could have a client, as we sometimes do, in San Francisco, for instance, or in another country, even in London. That's doing it has an initiative, and we can handle the PR, but you really want people on the ground who have their own local relationships. And so we were looking to join an association to give us that kind of scale that we don't have as an independent company. So PRBI has been good in that way too, because if I have a client, with a need in Asia or Europe or India, wherever it may be, we now have partners that we can work with, rather than just having to not have the chance to do that work and, having a global firm that's based in the US do it. We have our own network. And so that's been a really beneficial thing.
Agreed. I mean, especially in the last 6 months, I think it's been very great to have like-minded people and, let you know what is happening all around the world, one, and just boost your morale in another way. And by sharing their experiences and their stories. Yeah. So I'm going to call upon your experience over the last 30 years now. Can you share with us one of your most difficult cases in crisis management in healthcare, irrespective of the last 6 months?
Yeah. When I think of the most challenging things that we've worked on, one of the things that really kind of transformed our firm in a lot of ways was there was and we did not represent the company that was responsible for this. We represented the industry. But there was a bad actor that produced that operated as what's called a compounding pharmacy. Here in the States, we have these pharmacies that if you don't have a commercially manufactured drug to treat something, you can write a prescription, and certain pharmacies have the capability to basically make the drug from scratch. They use bulk ingredients, and pharmacists are trained to do that. There's not a lot of, it's a small subset. Most of the times you get a prescription from your doctor, you're going to go to a pharmacy, they're going to, pull something off the shelf and dispense it to you. But there are some times where you need these compounded medications. Well, there was one company that had kind of exploited the definition of a compounding pharmacy, and they were making huge doses, huge lots of medication. They created a drug, a steroid type drug that was sterile. It was an injectable drug, and it created meningitis, fungal meningitis in people who received the drug. And so there were, I think, I'm trying to remember the exact number of cases of people who died from this. I think it was around 700, if I'm remembering correctly. And so, it was one organization, but there's an industry of people who do this work and take it very seriously and believe in their profession and are honorable. And the industry was getting an enormous black eye from one bad actor. And so they came to us. This was in 2012, and they were all of a sudden, in the center of this, global story. And as you know, when things get seeded in the media and in the news coverage, it's very hard to debunk things that might not be accurate, or to prevent an entire industry getting painted with a very broad brush. And so we were brought in to really try to educate and inform the public about the value that compounders bring. That what this one outfit was doing, really wasn't compounding. It was really drug manufacturing, but under the guise of compounding. We were a much smaller firm, actually, even though we're still a boutique kind of by design. We were a much smaller firm then, but we had this opportunity to try to help this profession. And we knew a lot about the profession because we had some clients who were in it. So that was, that took a long time. That was like a multi-year engagement to try to rebuild the reputation of the profession. Congress even here in the US passed a law to further regulate compounding, and we were very involved in that, trying to make sure that the law would preserve the profession, because at one point in time the situation was so bad here that the thought was the industry might get regulated out of existence. Things like that really changed, and It was a really and I mean we basically we represented the association. They outsourced their media relations function to us. So, we were getting inbound calls from Reuters and, the New York Times and, major like global news organizations. So as much as it was challenging, it was also kind of exciting for us to handle that and to try to be the face of the profession, or at least an adequate spokesman for the profession.
I'm sure it must have, provided a huge impetus for growth at that point of time. Crisis can also turn into an opportunity, especially in the PR profession. So now that we're almost at the end of the year, what are your business plans for your company, for your agency, for the remainder of the year?
Yeah. By the way, I misspoke. It was about 70 deaths and 700 cases, meningitis cases. Our plans are, really we're very focused on growth at this point in time because we feel it's the right time for us to try to grow as an organization. We like being in the boutique space, and we don't ever envision ourselves being a large or mid-size or a large firm, but within the boutique realm we can continue to grow, and both in the size of the agency, the number of employees we have, but also in terms of the scale of the things that we're working on, and the issues that the breadth of the issues that we're working on. So I really view the next 5 to 10 years as we have very exciting plans to try to grow the firm, grow our reputation nationally, and work on really exciting things.
Yeah. So how do you plan to grow your firm? Have you decided, now that you've decided that you want to remain boutique, how does a boutique firm grow?
Well, I think that, as you know, in PRBI, there are some boutiques that are very, very small, solo practitioners. There are some that have, 20 employees. I don't think there's ever been a firm, kind of upper limit established on when something goes from a boutique to maybe a mid-size agency. But I think we have room to grow by, I hope over the next decade, by 2 or 3 times, where we are now. And of course, growth creates, its own issues, and we have to grow in the right way, and we have to scale. We have to be smarter. I think personally, I mean, I'm kind of I certainly wouldn't call myself an early adapter of technology. It's I always feel like there's new applications and products and that I'm slow to really adopt for our firm here. So I think part of it's being kind of smarter about how we work too. But no, I see us. I'd like to add in the next 2 to 3 years, multiple positions here.
Wow, that sounds exciting.
Well, that's the plan anyway. We'll see how you can ask me in a few years whether I was successful or not.
And I mean, it's always nice to first plan. Like you said, it's all about the details of the planning, right? So that goes to your business plan too.
That's right.
We can never predict the outcome. We can only talk about the effort.
That's right. And as the old saying goes, man plans and God laughs, right? And no matter how well you plan for something, you can be dealing with a global pandemic or something else, and that you never planned on or expected. And it's a lesson I try to teach, my kids all the time, is that you have to be, you have to be flexible because things change around you, and you have to be ready to change with them.
True. So has your definition of PR, success in a PR campaign changed?
Certainly the metrics have changed, even from when I started doing this a long time ago. I mean, there's so much more data available, analytics and social media with its tracking of impressions and shares. And, so, I think it's always important to keep clients focused on what PR is. It's different than advertising. It's not just making the cash register ring. It's about creating a reputation and growing that reputation, and building awareness. We work with a lot of cause-oriented campaigns. So people who are trying to change public policy, or kind of big picture issues like that. And in that case, it's very hard to measure, and it may take many times. We've had some clients that have been trying to get legislation passed, and it's taken them, for instance, certain healthcare practitioners want the ability to practice to the level they were trained. And there's creates a lot of controversy and infighting in the profession. And so some of those clients of ours, it's taken them like 4 or 5 times every year getting a bill filed to finally get it passed. So you don't have change overnight. It comes over a long period of time. And that's the thing that if you're thinking, we always tell clients, if you're thinking this is going to have an immediate, you're going to get a couple of news stories and have an immediate impact, you shouldn't think that way. You really have to think, long term. If you're thinking about PR, you really should be thinking about 6 to 12 months at least of work before, you end the campaign. And so that's a big discussion that we have a lot with clients who want to just do kind of one announcement and be done. And it's like, one announcement will be an announcement and you'll get news coverage. But if you're really looking to change the way the public looks at an issue, well, that's a long-term engagement.
Long-term engagement on that, true. So is there, so you look at every campaign and decide what the measure of success would be for that particular campaign? Or is there a standard method that you do recommend that somebody starts from, where they look at analyzing ROI or, the success as such?
Yeah, I think, this success in a number of different ways. There's measuring, media placements, for instance. People have an idea of where they want to be in the news media, and generating that is one measure of success. But, trying to create, it's what comes after the news coverage that's really important. Is there this sense of, greater interest? Is fundraising increasing? Are people, for nonprofit or an NGO, are people donating more? For a in the case of an organization that's trying to get see volume grow, what is the trend line on the volume? Those are so there's kind of immediate measurements of the PR work. Then there's really the longer term metrics. How many people go on your website? Is there, and what's a reasonable expectation? We always do these plans for clients, and we say, what's the metric for people coming to your web? How many more visits do you want? Sometimes people say, well, 20% or 25%, and we have to say, 2.5% is a significant increase. You have to have reasonable expectations, going into it.
A lot of clients just love adding a lot of zeros behind it. I wish we would do that as well.
Very much so. It's as in this business, we try to underpromise and overdeliver, and managing expectations is a big part of that. And really getting people to have a realistic sense of what's doable, because at the end of the day, when you look at brands, right, there's only going to be so many Googles and Apples and Microsofts, and for a lot of other companies, it's going to be slow, steady, incremental progress, and that's a good thing over time. But it might be multi-generational even.
Yeah, we don't know about that. So, top advice, let's say your 3 top, advice for brands that are struggling with crisis management today in the healthcare space?
Well, I think you have to be, first of all, adapt to the times. Here in the U.S., there's been, as I said earlier, it's been a lot of dialogue around racial equity and the growth of the Black Lives Matter movement. And there were some brands here in the U.S. that were just really tone deaf to that should have changed a lot sooner than they did. But there were some brands that had really, frankly, racist iconography, and one of those just announced in the Wall Street Journal earlier this week, big manufacturer of rice, Uncle Ben's Rice, which was really a very stereotypical name, and again, a logo that really was not appropriate. And, they finally are rebranding. But, you have to be really sensitive to the times and listen to people. And make and be flexible and change. And so I think that just because you have a plan doesn't mean you should just follow it blindly. You have to be really attentive to what you're hearing at the same time as what you're doing. And I think also it's just really important to be sensitive in communications, particularly with our healthcare clients. A lot of times in healthcare, when you're dealing with healthcare policy, the expected outcome of what you're doing is to save money, to lower healthcare costs, and to improve outcomes so people are healthier. But if you're communicating that, it's a very subtle thing, but if you're communicating that, don't you want to first say that your goal is to improve outcomes? And by the way, we're going to save money. You're talking about healthcare and human life. You need to value the right things and how you message that. So just being sensitive about how you communicate, I think, is really important.
So I agree. I mean, that's one of the most crucial things, and it should come naturally to a lot of brands in the healthcare space, but surprisingly, it doesn't.
Right.
We are running out of time. Last question of the day: what do you love most or hate most about your job?
Oh, that's a really interesting question. I love the fact that my job has always required me to really kind of think on my toes, my mind is always engaged in what I'm doing.
Right.
Not everyone, I think has that. There's a lot of different kinds of jobs there that you don't have that kind of, constant engagement and a lot of jobs are more rote and routine. So I really like that aspect of my job. And I think the things that I don't like are, one, kind of all the administrative issues you have to deal with when you operate a business. There's just a lot of, back end silliness that you have to, kind of manage through. And I think too, it's always troubling when clients when the expectations might not be realistic, or when sometimes, as you know, in this business, again, it's not advertising, right? So in advertising, you have creative, and then you purchase the space or the airtime or whatever the medium is, and now the ad might not be effective, and that may create disappointment, but you're at least delivering what you set out to do. But in the case of PR, you might pitch a story in a certain way and it might go in a completely different direction, even though you try to manage against that. You might have a really good opinion to share and you just don't have the level of engagement in terms of a publication that immediately wants to publish that. And so there's a lot of unknowns. And I think this challenge that PR practitioners have is managing the unknowns.
Okay, I'm sure a lot of PR practitioners will resonate with, your likes and dislikes about the profession.
Yeah.
So thank you for all the insights. Really appreciate you taking out the time today to speak to all of us and helping us a lot more about crisis management in the healthcare space and letting us, giving us a chance to know your firm better.
Thank you so much for having me on. I love talking about what I do and I appreciate having had this chance to do that. So thank you.
Awesome. Thank you. So that was our PRBI member, David Ball, president of Ball Consulting Group, LLC from Boston, speaking to us about crisis management in healthcare PR. We do hope the session helped you understand and know more about how to handle a crisis in the segment. Thank you again for joining us today for the session. We will see you again at our next live session with another interesting conversation on PR from an accomplished professional from the global PRBI network. So stay tuned.